William Blake described the eyes as the windows of the soul. Practically speaking, our eyes are the windows through which we view the world around us. Either way, there's no question that we place great value on our eyes and our vision. Surveys have shown that of the five senses, sight is the one that people fear losing the most. Given the important function of our eyes perform for us, it would seem to follow that we'd give them the best care possible. But sometimes we get too busy or we forget to do a few simple things that can keep our eyes healthy. Some people are just born with defective eyes, like other congenital disorders. There are many eye problems that are encoded into the individual's genetics. Their disorders can be include fairly simple problems like nearsightedness or farsightedness, or they can be debilitating problems like glaucoma. Even with the best care, eye problems will eventually crop up, whether it is just a pesky infection or a blurriness caused by overuse. There are many temporary eye conditions that can be quite frightening. To keep our eyes working at their best, we need to give them a little attention and avoid hazards and careless acts that can do our eyes harm. First, let's learn how to nutrition can help fortify our eyes. Vitamin A. For generations, mothers have told their children to eat their carrots to see better at night. Well, maybe so, maybe not. Actually, this bit of folk wisdom is a slightly distorted version of a known scientific fact. Carrots are excellent source of vitamin A, and one of early symptoms of a deficiency of this nutrient is night blindness. That's not the same, however, as saying that eating carrots will make normal night vision even better. However, please note that vitamin A is essential to healthy eyes and normal eyesight. Chronic severe vitamin A deficiency causes a condition called xerophthalmia or drying of the eye. It affects the cornea, the transparent covering that allows light to enter the eye. In xerophthalmia, the normally clear and glistening cornea becomes extremely dry. If left untreated, this condition can lead to blindness. Xerophthalmia afflicts some 3 million children each year in developing countries. Up to 250,000 of them end up permanently blind, a tragedy that could be prevented by adequate diet or supplementation with vitamin A. Antioxidants. Antioxidants are much in the news these days because of the evidence that they may prevent some of the biological deterioration that comes with aging. Researchers believe antioxidants benefit the body by preventing cell damage caused by oxidation. Besides reducing the risk of cardiovascular disease and cancer, antioxidants, along with zinc, may help protect against macular degeneration, a serious eye disease associated with aging. Minerals. In addition, antioxidants, certain minerals are also thought to be connected to eye health. Zinc, for example, has been shown to help reduce the risk of advanced age related macular degeneration. Eye injuries can happen most anywhere. Experts say that 90% of the eye injuries could be prevented. What it takes is a little extra vigilance in situations that makes your eyes vulnerable. Here are a few of them at play, whether it's an errant fishing line, a bouncing ball, a recoiling bungee cord, or flying campfire sparks. Recreational settings present serious eye injury risks. The best way to play it safe is to be alert. Pay keen attention to what you're doing and what's going on around you. Sports related eye injuries number at least 200,000 a year, with baseball, basketball, tennis, squash, and hockey players being the most susceptible. When you're on the field, court, or rink, wear protective glasses that protect you from the front and all sides. Glasses made of polycarbonate or another sturdy plastic are blessed. In the home, workshop, flying wood chips, ricocheting, nails, and splashing paint thinner, these are but a few of the dangerous posed by do it yourself jobs at home. Wearing protective eyewear may seem like a hassle, but it also might save your sight. Here in some of the gear to choose from. Safety glasses. These cost only a few dollars and offer protection when you are hammering or using hand tools or slow moving electric tools. Look for a logo that indicates the glasses have passed safety tests. Those made from polycarbonate will be the most impact resistant. Be sure that glasses have side shields too to deflect objects coming at you from the sides. If you need to wear prescription eyeglasses, you can also get prescription safety glasses. Safety goggles. These protect you from debris flying at you from all directions. Thus, goggles give you the most all round protection when you're working with tools, chemicals, and so on. Full face shields. These are a good idea when you're using a lathe or router. For instance, if you're welding, be sure that shield has special shading to protect your eyes from the bright light, because a shield doesn't protect against heavy impact or from objects that might fly up or around the shield. You should always use safety glasses or goggles under the shield. Yard work. Many people have discovered the hard way to even a simple chore, such as mowing the lawn, can lead to eye injury. Thousands of eye wounds result from stones or twigs being spit out by lawn mowers. So it's a good idea to wear goggles to ward off the flying debris. The same holds when you're trimming hedges. Branches can snap back and hit you in the eye. And when you're using a chainsaw, both a face shield and safety goggles are essential. Other home or fix-it chores. Lots of other home-related jobs merit wearing eye protection too. For instance, goggles can protect your eyes from falling grit when you're working under your car, from splashing chemicals when you're cleaning, or from dripping paint when you're painting the ceiling. Blunt trauma. Blunt trauma isn't the only way to damage your eyes. There could be small, seemingly harmless things you do each day that could result in serious eye problems. For some tips on preventing eye injuries, move on to the next section. Read in good light. Dim light won't hurt your eyes but can tire them more quickly. If it bothers your eyes to watch television in a dark room, keep a light on. If you have glasses or contacts, use them. You won't have to strain so hard to see. Use an anti-glare filter on your computer monitor. Position the monitor so it's at just below eye level and a little further away that you hold a book while reading. Take frequent breaks from whatever you're doing to give your eye muscles a rest. While your eyes are amazingly intricate and resilient, there is only so much abuse they can take. Over the course of many years, simple day to day actions can damage your eyes. Here are some dangers to avoid. Sunglasses are much more than cool shades. They are protective barriers that cut down exposure to ultraviolet, also UV light. a portion of the sun's rays that can cause such eye diseases as cataracts and macular degeneration. The American Academy of Ophthalmology recommends that you protect your eyes whenever you're in the sun, long enough to get a suntan or sunburn. Wearing a brimmed hat cuts sunlight exposure to your eyes by about half. Sunglasses will further boost your protection. The sun's rays can also reflect off the water, sand, and snow. So it's advisable to wear sunglasses in addition to a wide brimmed hat in these environments. You can get good UV blocking even with an inexpensive sunglasses. Recommendations are that no more than 30% of sunlight should reach your eyes. In bright conditions such as on sunlit sky slopes or the beach, it might be better to wear sunglasses with a transmission factor of only 10%. Keep in mind, too, that dark glasses with no UV blocking give you no protection whatsoever. In fact, they boost your risk of eye damage because they dilate your pupils that lets more light in without blocking the harmful UV rays. Here are a few points to keep in mind when you're buying sunglasses. Lens color has no bearing on level of UV protection. Polarized lenses are not necessary for UV protection, but they do cut glare from reflective surfaces. Sunglasses that are darker on top and gradually clearing toward the bottom don't shield your eyes well enough when you are out in the open sunlight, such as on the beach or sky slope. They're fine, however, when you're driving in a car. Test non prescription sunglasses for distortion by holding them a few inches in front of your eyes. Look through the glasses to focus on some rectangular object, such as a window frame. Move the glasses slowly from side to side, then up and down. If straight lines look squiggly, the lenses are poor quality. Be sure the sunglasses feel comfortable, otherwise, you won't want to wear them for long periods of time. Be sure the sunglasses are labeled as providing protection from ultraviolet A and ultraviolet B. Remember, the price is not a good indicator of sunglasses' protective quality. Some very expensive designer sunglasses do not provide very good protection. Eye strain, such as from reading or sewing, doesn't really injure the eyes, but it makes them tired. To be exact, it isn't really even the eyes that get tired or strained, but the muscles around the eyes. The best cure for eye strain is to give your eye muscles a rest. Take a break from what you're doing, close your eyes, and give them nothing to look at for a while, or stare off into the distance for a moment. Also, having sufficient light to read or work by helps prevent eye strain in the first place. An adjustable gooseneck lamp lets you concentrate light where you most need it and not where it will irritate your eyes. Remember, the finer the task the light required is more. Although eye strain doesn't harm your eyes, it can cause discomfort such as watery or dry eyes, difficulty focusing, fatigue, and perhaps an accompanying headache. Although eye strains itself isn't serious, it can be one symptom or serious conditions such as glaucoma. If you're bothered by long lasting, frequently recurring eye strain, you should see an eye care professional. People with diabetes need to be particularly concerned with protecting their eyes. The complications of diabetes pose several serious threats to the eyes. The major eye disease risk for people with diabetes is diabetic retinopathy, in which abnormal blood vessels grow across the retina, damaging and sometimes permanently destroying vision. Diabetic retinopathy afflicts about one third of people with diabetes. Typically, after they've had diabetes for at least a decade, about 5% of people with diabetes end up losing their sight because of retinopathy. In fact, diabetic retinopathy is the leading cause of blindness in people younger than 60 years old in the United States and Canada. Diet, medication, and exercise are key to controlling diabetes and reducing the risks of retinopathy. High blood pressure increases the chances of developing retinopathy. Keeping close control of blood sugar levels is known to decrease a person's risk of progressive retinopathy. Anyone with diabetes who's at risk should be screened at least yearly for this eye disease. Even if there are no vision symptoms, if caught early, advancement of retinopathy can be sometimes be halted by laser treatments. Those recently diagnosed with type 2 diabetes should have an eye exam soon after the diagnosis is made. It's common to have diabetes for some time before being diagnosed, and eye damage may already have occurred. True to human nature, most of us wait until our eyes are bothering us before we get a checkup. The problem with that approach is that we could not have an eye disease without knowing it. By the time we get to a eye care specialist, we might have lost some valuable time for treatment and some vision capability. Catching an eye problem early boosts the chances of successfully treating it. So, your best bet is to get a checkup every 2 to 4 years between the ages of 40 and 65, and every 1 or 2 years after age 65. If you have diabetes or a family history or conditions such as glaucoma or macular degeneration, get a checkup once a year. Blacks and people with severe short sightedness are also at increased risk of glaucoma and should consider regular screenings. What sort of eye specialist should you visit? Both ophthalmologists and optometrists are trained to evaluate eye problems. In most places, only ophthalmologists who are medical doctors can prescribe medications to treat eye diseases, and they are the only ones who can do eye surgery. A third kind of eye specialist, an optician, is trained only to make and fit prescription eyewear. Since childhood, most of us have heard the old warnings about not reading in dim light or watching television in a dark room or sitting too close to a television or reading without glasses. All of these actions would have been told are supposed to hurt our eyesight, not so, say eye specialists. Sure, these activities may make your eyes tired, but they can do your eyes no actual damage. Sometimes even the best prevention efforts can't stop a problem from cropping up. The following are some of the most common eye problems, how to recognize them, and how to deal with them, and how to keep them from coming back. Blepharitis is an inflammation of the edges of the eyelids, causing redness and thickening. Scales and crusts or shallow ulcers may also appear. The disease is common, especially in children, and often affects the upper and lower eyelids of both the eyes. There are two types, ulcerous and non-ulcerous. Infection of eyelash follicles and oil glands cause ulceral blepharitis. The non-ulcerous variety, which is more common, can be caused by an allergy or seborrheic dermatitis, which is an inflammatory scaling of the scalp, eyebrows, or ears. Lice can also sometimes cause the non-ulcerous type. Symptoms of blepharitis include itching, burning, red-rimmed eyes, swelling of the lids, loss of eyelashes, and irritation of the underside of the lid. Conjunctivitis, also called pink eye, is an inflammation of the conjunctiva, a delicate membrane that lines the inner surface of the eyelid and covers the exposed surface of the eye. Children are more commonly affected than adults. Bacteria and viruses are the usual causes of conjunctivitis. Allergies, chemicals, dust, smoke, exposure to chlorine in swimming pools, or foreign objects that irritate the conjunctiva may also lead to this condition. Occasionally, a sexually transmitted disease can cause pink eye. Symptoms of conjunctivitis include redness of the eye, grating sensation, burning, itching, light sensitivity. Detached retina normally The retina is firmly attached to the choroid, an underlying layer of tissue that is rich in blood vessels. Insufficient blood or other fluid collects between the retina and the choroid. The retina can become partially or totally detached. Initial symptoms of a detached retina include seeing floating dark spots or streaks of light and experiencing blurring of vision. This can occur suddenly or gradually. As the condition progresses, a curtain or wheel seems to fall over part or all of the field of vision. To safeguard your sight, you should seek medical attention immediately if these symptoms develop. Cataract surgery. Severe nearsightedness and injury can cause retinal detachment. Conditions that heighten susceptibility to this condition are inflammation or tumors of the eye, high blood pressure, and hemorrhaging inside the eye. Treatment procedures include, among others, laser fusion and surgery. Left untreated, detachment may worsen and eventually lead to blindness. Newborn babies are usually given antibiotic eye drops soon after birth to prevent development of conjunctivitis that could badly damage their eyes. Conjunctivitis is usually not a serious disease and may or may not require medical care. There is one important exception. Anytime conjunctivitis appears in a newborn infant, treatment should be sought immediately. The baby's vision could be at risk. When your eyes don't tear properly, they can sting, burn, and itch. These are the symptoms of dry eyes, a condition most common in women after menopause. Anti anxiety and sleeping medications, antihistamines, decongestants, and some arthritis and high blood pressure medications also can cause or worsen dry eyes. Sometimes an allergic reaction to eye drops or an infection that blocks the tear ducts can result in dry eyes. Or the condition may, in rare cases, can be result in Sjogren syndrome, a chronic connective tissue disorder. Dry eyes often accompany blepharitis. See your doctor for your diagnosis. Artificial tear preparations can help relieve the symptoms. Avoid over the counter eye drops that contain vasoconstrictors. These may cause further drying. Other steps to take: avoid tobacco and other air irritants. Don't aim hair dryers toward your eyes. Wear glasses to protect your eyes from wind. Wear goggles while swimming. Keep the relative humidity of your home and office between 30 and 50%. Red eyes can signify a variety of troubles, from lack of sleep or a minor medical condition to a major vision threatening illness. If sleep deprivation isn't the problem, your red eyes might indicate a small problem that will heal itself, such as a rupture of the tiny blood vessels of the conjunctiva, possibly caused by hard coughing or sneezing, and allergic reaction, a bacterial or viral infection of the conjunctiva, the onset of a stye, iritis, and inflammation of the uvea. The layer of the eye that includes the iris, a trauma such as a foreign object in the eye, which may require first aid and possibly professional medical attention. To get rid of redness, you can use decongestant eye drops available over the counter. But don't overdo them. Also, before using drops, check with your doctor to be sure of your eye redness isn't a symptom something serious. Also, anytime you have red eyes along with pain, significant eye discharge, blurred vision, or severe sensitivity to light, see your doctor. These symptoms could indicate an inflammation on the inside of the eye, an ulcer of the eye, or even glaucoma. You should never rub irritated eyes. If a foreign object is in your eye, you could cause serious damage. A person with night blindness can see fine in a good light but not in a dim or fading light. Causes of night blindness include either a severe vitamin A deficiency or an inherited degenerative disorder of the retina called retinitis pigmentosa. In the case of severe vitamin A deficiency, treatment would be administration of the vitamin. A physician's care is crucial, however, to be sure that night blindness is indeed the problem and that the doses of the vitamin are safe. Vision problems are common and affect everyone from infants to senior citizens. Proper eye care and eyewear at every stage in life are very important in order to see clearly and prevent future eye health issues. A problem with a child's vision can be the underlying cause of learning difficulties in school. The process of learning is highly visual and is dependent on clear vision. Eye care for children begins at the start of life. A pediatrician should examine a newborn infant's eyes at birth. Eyes examinations should also be performed when a child is 6 months old, 2 years old, then at least every 2 years after that, unless more frequent examinations are required. Teenagers are prone to ultraviolet rays from the sun and the harmful impact ultraviolet rays can have on eyes if protective eyewear such as sunglasses are not used. Research shows 80% of a person's lifetime exposure to ultraviolet rays occurs by the age of 18. Extracurricular school activities such as sports oftentimes necessitate protective or corrective eyewear. Clear vision helps teens participating in these programs perform at their best. Protective eyewear worn during these types of activities prevents eye injuries. Regular eye examinations during the teen years are essential to future eye health. Corrected vision and healthy eyes are vital to adults. We all live in very busy lives and need to take care of all aspects of our health, including eye health. In order to cope with stress and enjoy life to the fullest, while you may not notice any issues with your vision or overall eye health, a regular eye exam is still necessary to detect problems that may be emerging. If your family has a history of eye disease, diabetes, and high blood pressure, regular eye checkups must be conducted to monitor and identify whether or not these conditions are affecting you. As we continue to age and reach the advanced stages of life, the risk of eye disease and eye problems increase dramatically. Annual eye examinations are critical to maintaining vision and staying active during your senior years. Thank you.